guys, Dr. Gnarl. First of all, I want to congratulate you on your commitment to doing whatever it takes to beat your neuropathy. And so what you have and what you're left with is the home care kit, we call it. And what I'm going to do is I'm going to walk you through all the pieces of the kit and all the different variations of how you might use it depending on if you only have neuropathy in your feet or if you have neuropathy in your feet and your hands. So this is the order that I recommend that you do the home care. So we're going to start off with, say, your feet. Here in a minute, I'm going to show you how we would adapt it for hands and feet, so you're doing equipment on both your hands and feet at the same time. Right now, because the vast majority of our patients are feet only, I want to do that first. All right, so let's get started. So in your kit, you have a box, two boxes that have nerve beam on the top. And when you open them up, there's one box, and inside is the light wrap, we call it. So you've got almost 200, I think 140, 150 diodes emitting 3 different wavelengths of light. So here's how you're going to get it out and get everything ready. So pretty simple. We're just going to wrap it around our foot, and then we're going to take the Velcro that comes in within the wrap, and you can take this sticker off. You don't have to leave the sticker on. And we're going to take it over here like so, attach it, come around here and attach it. It does not have to be super tight. In fact, I don't want it to be super tight. A little bit of, if you'll notice these little knobbies on the wrap, that actually keeps your feet off of the diodes because we don't want it directly on your skin like that. Then we're going to take another Velcro and we're going to slap it on this side here, and then we're going to come around. Now, let me get this one set here, and I'm going to leave it a little loose because I want to show you something here in a second. We're going to get our other boot, get it on, get our Velcro underneath, get it set, come across here, over the toe, get on there, sucker, good. All right, now, before I put this other strap on, in the other 2 boxes, you're going to find the power cord, and I'm not sure what this is called, but it plugs into that. All right, now, you notice I'm not using 2 power cords. There's a power cord in each box. We're only going to use one. You're going to come down, it doesn't matter which one of these you choose, you're going to plug in the main power supply into one of them. In the box, you'll also find a coupler. So this is going to couple power from the left boot, in this case, over to the right boot. So that goes in there, and now it comes over to here. So now what I want to do is I'm going to go ahead, maybe come across, tighten this up just a bit more. Put this Velcro on this one here. Kind of go underneath that. There. And so we're going to finish up by taking the strap over here like so. Now we're going to turn the boots on. So I'm going to come to the power button on this boot. I'm going to push it one time. You're going to see that red glow, and notice that the color of the light is green. I want to push it one more time to go to blue. When it's blue, we're not just shooting out the red lights, we're shooting out 2 other infrared lights. The red is going to be for what you can feel, pins, needles, numbness, tingling. The infrared lights are going to be for the blood supply. So if you remember that thermal image we took of your feet and or hands, and we want it red all the way to the tips, but yours might have been yellow, green, or blue. This is going to help with the circulation. But notice the other boot's not on. So I still have to go turn the other boot on to blue, and now it's going to take 20 minutes. So we're just going to kind of sit back in your chair and just relax. All right, and after 20 minutes, they automatically turn off at 20 minutes. So once they turn off, I'm going to pretend like they're off. All right, now what I recommend is just undo the top portion, leave the bottom portion, leave them coupled together, and just slide them off, and then you're ready for your next session. Just try to leave it all together. All right, that's the lights. The next thing you're going to do is what we call the nerve spa. So you got when you open up that box, you're going to see a bucket like this, which got 2 sides to it. All right, and what you're going to do, you got Epsom salt, you have the effervescent conditioning tablets, So what you're gonna do is you're gonna fill this up to halfway, which is about right here. There's a ridge right here. You can see it on the inside as well. You're gonna fill that up with what I call hot tub hot water. It's like a real hot bath, all right? The hot water helps to open up the pores of the skin. We get the signal into the skin a little bit easier, but it also, you're gonna have your feet in here for 30 minutes. I don't want your feet getting cold, all right? So you got the water in there. You're gonna take the Epsom salt, and you're gonna put 1 tablespoon of Epsom salt on each side, okay? And then you're gonna take 1 of the effervescent tablets. These are just conditioning tablets. Lots of times when you have neuropathy, even on the skin, you may have noticed over the years, your skin's kind of gotten dry. It's because the nerve endings going to the sweat and what we call sebaceous glands and the oil glands in the dermis of the skin, well, those nerves have been affected as well, and that's why your skin's gotten dry. But when you're doing the foot bath a lot, you know, twice a day, every day, your feet can dry out. So these are just conditioning tabs. If you don't want to use these, or if you run out of these, or if you're a lady who uses lotion anyway, you're doing the same thing, all right? So you're gonna put the 1 tablespoon Epsom salt, 1 tablet each side. So each time you do the therapy, it's 2 tablets. And then you're gonna take your nerve regenerator. So you got it here. The cords, the leads go in, and if Emma zooms in, okay, there's a white symbol there that represents where you plug it into charge. Notice that this is 1 is on each side of that, okay? So that's where that goes. So now you're gonna put your feet in, all right? Feet in, 1 probe on each side. I had it, and then I'm trying. There we go. They don't have to be touching your feet, the leads, okay? You have to step on them. In fact, I don't want you to step on them. I want them to be exposed to the water. Then you're gonna push the power button on the side of the unit here, and you're gonna hold it until it turns on. So it's already set. If you look at the top, the arrow over on your left, it says feet. If I'm doing hands, I just touch the arrow and it moves over to hands. But right now we're focused on feet, so we'll just move it over. It's already set to 30 minutes, so you don't have to change that. And now the minute I start pushing up the intensity, all right, you'll notice that the clock starts ticking, okay? So we're gonna turn it up, like we said, and we highlighted on the sheet of paper that's in the box, until it's a comfortably strong tingle, okay? However, we do not want to go past 30. 30 is the max. I know that the unit can go past 30, but I don't want you to go past 30 because you can kind of overdo it, all right? And what you're gonna notice is over time, as the days and the weeks go on, you're not gonna be able to take it up as high as the nerves begin to heal, okay? So once you get it set, 30 minutes again, you just relax, right? And if you notice as the treatment goes on, you don't feel the tingle anymore, you don't need to go and turn it up. Everything's fine, you're still getting the signal through, okay? And so, pro tip, because some patients have learned the hard way. When you get this set and you're relaxing, don't just set it like right here, because what we've seen happen is plop into the water. And guess what you're having to do? Buy another one. So what I recommend, there's a belt loop on it. You can hook it to your belt loop, or just set it on the ground next to you, all right? Or you can kind of put it in the seat next to you where you're sitting on it a little bit. That's fine. All right? So that is feet only. So how do we adapt this if you are hands and feet? So while I'm doing this treatment, let's go ahead and just pause that. Okay? Pause that. Pause it. Okay? All right. So while we're doing this, you're going to take your wraps that you have, all right? And then what you're going to do is you can kind of put them in your lap, put them on the floor, or not the floor, but on the armrest of your chair, okay? And then what we're gonna do is, we're going to take these, and we're just gonna kind of basically fold it in half right over our arms, okay? And then you'll take the straps. It's okay to go ahead and get one strap kind of done, like so. Then you can slide, on this one, with the arms, you don't even really need to use two straps. You can just use the one. So we're gonna take this one, we're gonna undo it here. We're gonna fold this in half, basically, all right? And you might wanna get these straps fixed before you get started, right? So fold it in half, take a strap around the side, hook it on, boom, power, 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 power. And now I'm sitting here with my arms rolling in my strap and my lights, okay? So now I got both hands working at the same time that my feet are in the foot bath. So these take 20 minutes. The foot bath takes 30 minutes, so this will finish ahead. And then we just kind of pause and we wait, all right? So let's say that's done. So now we're gonna go, okay, we're done with the hands, with the lights. So now what I'm gonna do is I'm gonna move my tub out of the way. Now I've got it set for my feet. So I just kind of loosen this one. It's ready to go. Feet slide in, strap under the toes, like so. Okay. Give a little slack there, good. Back up on my calf. It's good quality Velcro. There you go, good. So we're here. Good. There. Here. Get the Velcro. Okay. All right. We're here. We're here. Yeah. So there's a little fumbling around. I get it, right? But once you get this thing, that every single patient that I've had over the last 8 years has said, once I get through the first 3-4 days, I got the routine down, I know how things work. Boom, 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 boom. Remember, we want blue. Now, if your hands, what you're gonna do is you're gonna take this, okay? And what I'm gonna do is I'm gonna take these carbon leads off, set them in my bucket, all right? Now, what you gotta do with the gloves is you gotta get them wet, okay? What I recommend is you can just use the water that you got, okay? And then what I want you to do, kind of, do not like wring them and squeeze them, all right? Just get them wet, pull them out, and you need a dish towel. So you're gonna lay it on the dish towel and then fold the other side over and just kind of pat, but you still want them pretty damp. Then what you're gonna do, you're gonna take the leads and plug them in. I don't have my glasses on. There we go. There, and here. And I know they look small, but they stretch. Okay, so we're gonna put these on. They're wet, they're damp. Okay. Just work them on. The more you use them, the more elasticy they're gonna get. So we'll get. All right, so they're on. Okay. Then I come back, the unit's back on. I now touch hands. I now start up in the intensity. Now we're good. Now I've done, now I've switched. Okay? Now, important note. Let's take these off. You'll notice on the Nerve Spa, the foot bath, Emma, zoom in there for me. You've got one red and one black lead, okay? Everybody see that? One red, one black. So what I want you to do is you're gonna alternate which side is red and which side is black with each time you do your therapy. So if you've got this plugged into the red glove, or if the red to a glove, and let's say you're gonna do the right is red first and the black glove In the afternoon session, you're going to switch and have the red lead go to the left, black here, and on the bucket with the probes, same thing. If you do red probe on the right, then in the afternoon session, you want to switch. Why? Well, one side is the outflow of the signal, and the other side is the return. It's obviously going to be stronger on the outflow than on the return, so we want each leg to get that outflow at least once during the day. So morning might be the right, afternoon might be the left that gets the red or the outflow, okay? So that's how you do your home care kit. We've done it legs only, we did it legs and hands, and all you gotta do is just get the routine. It's gonna take you an hour to do, whether your feet alone or your hands and feet, it's still gonna be the same. So the key is this: everything that you have at home works as long as you do it, all right? So I made this video so you can play it, you can pause it, you can stop it. You've always got it until you get the routine down, okay, as far as the home care equipment. Now what I want to do is I want to walk you through the nutritional products, okay? I'm going to turn these off. Very good. So here's the nutritional kit. In the kit, when we open this up, you're going to find 4 different products. So the first product is your VasoPro. She's going to zoom in there, and they're going to have it written down at the bottom. You're going to take 1 scoop 2 times per day. All right? With this, actually, you know what? Let's back up. Here's how I want you to do it. You're going to take the Inflamex. Inflamex is 2 droppers full. So an entire dropper twice. What's a dropper? As much as you can squeeze and as much sucks up into that tube. It's not going to be all the way. And then what I want you to do is squirt that into like a shot glass or a cough syrup cup. Don't try to aim it underneath your tongue, okay? Because I don't want this touching your lips, your tongue, or your teeth, because any of the normal bacteria in your skin will go in here and start to break this down. So we're going to squirt it into a shot glass or squirt it into a cough syrup cup, even if you have one sitting around. 2 droppers full into that. Pour it under your tongue, and you're going to hold it for 2 minutes. In that 2 minutes, you're going to take 1 scoop of the VasoPro. You're going to get a glass of water between 8 and 16 ounces. You're going to put 1 scoop of VasoPro in it, 1 scoop of the Greensberry. Okay? I've already explained to you what these products are in the office, so I'm not going to do that again. But you're going to take 1 scoop of each, put it in the water. If you've got a shaker cup, you can use juice if you have to. If you want to make a smoothie with like one of those Ninja Bullet blenders and some coconut water or some milk and some frozen berries, whatever. And you're going to take that. The first drink, you're going to swallow down the Inflamex that you're holding under your tongue. All right? You're going to do all of this twice a day. The lights twice a day. The foot bath, the gloves if necessary, twice per day. Your supplements twice per day. Also in here is NeuroSoothe. This is just, you can use it as often as you want. If your toes hurt, get pins and needles to it. It's just something that kind of helps to knock down the symptoms if it's kind of driving you nuts. All right? A lot of people love this. And so that's the entire home care kit. That's your equipment. That's your supplements. All right, one last thing that I forgot to point out. Inside your bag, you're going to get a charging block and a charging cord. That goes to the nerve regenerator. This plugs into the wall, and the charging end goes into this middle hole where it says that. Plug it in. There you go. The charge lasts a long time, so you're not going to charge it every time. All right, that's it. Just wanted to add that. So again, proud of you. We appreciate you. We're here for you. So if you have any questions on your next visit to the office, don't hesitate to write it down on a notepad. Either myself, Dr. Aaron, any of my staff can answer any of your questions. They're all highly educated and know exactly what everything does and what it's doing and the purpose of it. But we're here to support you so that you get your life back. All right? Appreciate it. I'll see you when you come back into the office next time.